This podcast centers Symeon Ivey as one of several Black men's voices in advancing Black feminism in public health. Symeon Ivey holds undergraduate degrees in psychology and sociology and a master's in community counseling. He has served as the mental health director at Georgia Diagnostic and Classification Prison. Additional work included serving as the data manager and senior evaluation coordinator for Messages of Empowerment Productions, where he worked in my program evaluation and behavior intervention practice areas. Listen in as Symeon and I discuss how he was the first intern and first full-time employee for my public health consulting firm, where he reflects on professional lessons learned working for a Black feminist. Symeon then provides insights on Black men's unmet mental health needs and more practical strategies for reaching and engaging Black men in difficult conversations around emotions and mental instability.
Wow, what a wonderful blog I have today. This right here, this one is going to be emotional on a number of levels. Not only are we talking about men's mental health today, but I am actually talking to the Symeon Ivey, who when I was starting to student teach, Symeon Ivey was in my social problems class at 8 o'clock in the morning. He made me like teaching at 8 o'clock in the morning, 8:30 in the morning, when I didn't even want to be there at 8:30 in the morning. This young man was there faithfully early in the morning, and then we'd go and work at Einstein Bakery right after that. Before. Oh wow! And I just remember we took we had dinner at Fogo de Chao. I had never been there before, and I was trying to impress you because I was working on my first employee, and my first employee was, how old were you at that time? 17, 18, 19?
Yeah, if 19. Yeah.
If 19, right? And you were a sophomore. We did some internships, and then we found this office space inside Atlanta. Remember when Nina Smith Bankhead gave us the 2 offices right outside of her office? And that was our first team office outside of my basement, my home basement. And so I'm excited to be with you because you remember when gyms was just a thought. You've gone through all the employees. Everybody that worked for gyms had to go through you. And so it's just fitting that as I talk about advancing Black feminism in public health, and how do we finally get to this point of including Black men in the conversation, because as you remember, you know, you were in the room when it happened, so to speak, right? And so I've always known that I could not do a male program for a number of reasons. And one of the reasons is, you know, this is where Black feminism takes a demarcation from mainstream white feminism, is that we don't see Black men as the oppressor. You know, we have a Fannie Lou Hammer about ours, like, we don't want to be liberated from Black men. We want to walk side by side with them. We want to be in collaboration with them. We sort of like some of the fellas, you know? To each his own.
Yeah, it definitely doesn't look the same to us.
It does not look the same. So, Symeon, what you been up to since you got your master's in?
I got my master's in community counseling.
Yes.
Did a couple more internships
right.
at the Riverwoods. Ended up working there part-time, a little full-time, but mostly part-time. And got a job at Georgia Department of Corrections as well.
Right.
Ended up being the mental health director there, and got in that department inside of Georgia Diagnostic.
Wow, look, y'all see that? That's a shameless plug for me. I'm about to take all the credit. Y'all see what an internship by showing some interest in young men. You know, a lot of the people that have come in to talk about Black men have talked about the fact that you need exposure, you need mentorship. And I know your walk is one that if you were not the first to go to college in your family, you were one of the first.
Yeah, definitely.
You were the first?
Second. There's still not a day that goes by that I don't utilize the things that were taught.
Really?
Not one day.
What was some of the things now?
Even from when I walk in, and of course I do some insurance work, but even when I was working in the prison, I'm always looking at everything that I see. I'm always taking notes.
You gotta know what setting you're in. You gotta know your environment.
It's always a sign-in sheet. I'm always counting. I'm always catching, comparing, contrasting, looking at what's in the room. So it's not a day that goes by that I don't think about some of the questions and the framing that we definitely had to endure. So.
And I remember one of our projects we did, remember the behavior health project where we had to make sense of all those mental health assessments?
Yes.
So Symeon and I had the privilege of being the evaluators for a community foundation public health program where they actually were the first. Remember before treatment courts were a thing, right?
Mm-hmm.
We were doing some of the piloting evaluation of those, and we got to see a lot of mental health assessments. We got to see just how frail the mental health system was.
Mm-hmm.
And so I knew that in designing a program, and we saw a lot of men in that work. I think if I work in working with women and girls, was directly with women and girls, I think some of our evaluation work, we got to see Black men on paper, right? And I think looking at those assessments, we saw a lot of anger, a lot of depression, a lot of substance abuse, overuse that was, in my opinion, masking some of the emotions that
needed to be shown.
Right, that needed to be shown, right? And so, so I think I want to start the conversation. If we're designing this appropriate program for young Black boys, and one of the tenets of this program is emotions, and I talk about how do we, have we socially constructed masculinity in such a way that doesn't even allow boys and men to express emotions healthy in our society.
I 100% agree. I think until recently, when I say recently, meaning the last maybe 18 months, and I might be exaggerating saying 18 months, but definitely men haven't felt, or boys felt the need to be able to express those emotions. Even talking with your hands, that's something you can't do.
Why is that?
It's looked at as a female trait. That's what I was taught from my uncles. That you showing emotions. You're doing too much hand movement. Keep your hands down, because to men, if you're using too much movement with your hands, you want to fight. So men don't talk a lot.
That's why girls all that.
That's triggering for me. That's very triggering for me. Yeah.
So no wonder you speak done when I'm talking and speaking, and I'm thinking that I'm being over dramatic, and you're like, oh, wait.
What you trying to say?
What you trying to say? Right.
So I mean, even if you watch a lot of men and look at Dr. Phil or some of his interviews, men always.
So even the symbolism of looking weak, you can't sound weak, you can't express weakness, you can't look weak.
Definitely look.
Right, and that boils off. So then what happens to our anger and our sadness and our depression?
Anger is the only emotion that's allowed to be shown.
Oh,
even if I'm feeling sad, I'm still going to portray it as anger. Even if I'm feeling depressed, I maybe go smoke a cigarette, maybe go drink a little bit.
So I'm self-medicating.
Definitely.
So I'm doing, and now I'm taking money that I should be using in other areas, and I'm medicating. So, and it feels good. I don't know what y'all told me about this. I'm gonna be cracked out, and my lungs gonna be broken down, because right now my problems are solved.
I'm gonna go pop these bottles,
and
that's gonna make me feel a little bit better.
Right, not a little bit better, a lot better, and I may get some females in the process, right?
Mm-hmm. And that's another thing that we utilize. The more the merrier, some may think. Mm-hmm. Having sex with multiple women, multiple partners, make us feel better.
Okay.
So that could be another one.
So I'm solving my own problem. So how now, when public health says I need to treat you like a victim, and I need you to come in and be vulnerable and talk to me, and I'm saying I'm not coming into this situation because what?
Vulnerable.
That's nothing. You lost me with that word, right? That ain't even a word. You can't even say vulnerable. You laughed at I don't even have the right vocabulary. School me. Look, this is the day that the professor becomes the student and the student becomes the professor. School me. Like, Doc, you can't even use that vocabulary when you're talking to me.
Can't say vulnerable. Let's say when I was talking with some of my inmates, my word was, tell me what you're thinking.
Tell me what you're thinking.
What does a day look like? But can't say vulnerable. And if you tell me, and if I tell you, okay, I see you was looking down, tell me what's going on in your head. Like if I could picture what's going on with you, what does it look like?
I hear, and look, what you're saying also, you're not asking them questions. We ask females questions, or we ask women questions. You're telling them, tell me, you're giving them a director. Tell me what's going on.
Because if you notice with guys, and I hate to say it that way,
Well, no, let's speak to the fact that we are in this quasi space where we're conflicted in terms of we know best practices, but we also know when we're walking in from a reproduction of sociology standpoint, meaning some passed on, some learned behaviors that we can't undo all of that. So we gotta try to fit in some evidence-based stuff, but at the same time, know that this person is acting and reacting in the way in which they've been socialized.
But think about it, why would Boy Scout be so effective? Why is the Army so effective in dealing with men? Men follow that structure, and we like that directness, that let me understand and try to feel or interpret what you're thinking. Even though we don't like to give that emotion out, we prefer the directness.
So speak that, and I think that when I look back on how I managed you, I think that is what worked for those, what you worked for me 5 or 6 years, and I think that giving you clear direction, like, hey, Symeon, this is what we're doing today, this is what we're doing this week, and you're like, bet, got it. Even the way you came down today, the way you came into the podcast studio, this is your first day here, right, in the new podcast studio. But the day you came in and you went right back into troubleshooting, like this is what we've always done. You came in unplugging stuff, moving stuff. Hey, you got a port right here, And I think once a person knows this is a structure, this is a setup, then you start to operate. Now, I'm gonna play. I hate to say devil's advocate. I'm gonna debate you on that. All right, I'm gonna debate you on that. So on the one hand, we talk about the educational system being too structured in a way that it puts black boys in a box where their best learning methods or ways of expressing themselves are shut down. Right. They, connect, they like to touch things, they like to experiment. Our system says, sit down, shut up, get in that seat, and let me teach you something. So, what's the balance?
Where's workshop now in schools?
Okay.
I think with
it's disrespected.
Right.
It's disrespected.
Because even if you look at a lot of the places that we come up around, especially in Atlanta, there's a lot of small businesses that thrives. You can look and see lawn care is doing great, plumbing is doing great, but what does that look like in the school system? We don't talk about when we're taking the SAT, if this part was connected to this, what would that ratio be? We don't think about it that way. It's always talking about, okay, if this yacht went X amount of knots, that doesn't relate to anything.
Right.
When have I been on a yacht?
Can I tell